As we just heard with Dr. Tracy Collins, Native communities have been especially hit hard by COVID-19. It was a shock then when Acoma Pueblo Governor Brian Vayo announced the Indian Health Service was closing emergency and inpatient care at the Acoma, Cañoncito, and Laguna Hospital. That's 25 beds serving 9,000 people. Governor Vayo called it, quote, reckless, immoral, and simply unacceptable, end quote. Now Laguna plans to open its own facility next year. And the Navajo Nation built its own medical facility a few years back, so there's movement to get better health care. But Laura, the governor's issue seems to be timing. Does he have a point here?
I mean, this is such a complicated issue. I really feel like people are making decisions based on the information they have in front of them, and not necessarily taking into consideration the impact on other communities.
Right.
And this was one where probably more communication would have been better. Making a decision with additional stakeholders. And I think that's just sound advice for anybody in this situation. Leadership is important. It's important to make those tough decisions. That's why people are in leadership positions. But it's also good to try to get as much feedback as you can and buy-in from other communities. Something that drastic is going to have a very, very difficult impact, disproportionate impact on communities that rely on those services. Mm-hmm. So I think that, it's hard for me to sit here and criticize a person's decision based on the information they had, but it's clear that more communication and input from others would have been helpful to avoid such a difficult situation for them.
Mm-hmm. Hey, Giovanna, Governor Vayo's issue was that he said there was no consultation with the tribe prior to the suspension of those hospital units. It's hard to imagine that, they would hear nothing, but it seems like that's what happened here. And there's an issue of fairness trying to kind of scramble here, especially given how COVID has hit some of the tribal communities in our state. Could something have been handled a little bit better from the view you're seeing this from?
Yeah, I mean, as Laura said, obviously this wasn't handled well. There are difficult decisions that need to be made and long-term planning, but someone isn't looking at the big picture here. Mm-hmm. And the fact that the federal government is bound, to have these negotiations and talks with the Pueblo, and that didn't happen, that's a problem. And so I think that we're not I don't know that we have all the information yet about this, but clearly it's gone wrong. Mm-hmm. and someone's not looking at the impact. I mean, regardless of who's doing what and making what decision, that the outcome is that 9,000 residents don't have access to this facility anymore. And the nearest ICU beds are in Grants, and there's only 3 of those. And right. So it's a really big problem that needs, more, it needs to be addressed.
Mm-hmm. Tom, those are the clinics I mentioned up top. That's, good news. They're coming online at some point. And Indian Health Services said they didn't have enough staff to keep the ER going at the Acoma Cañoncito Laguna Hospital. And that's a staffing issue. They're leaning hard on that. In my gut, it says that's something that should have been addressed a year ago, a year and a half ago, or at the beginning of the pandemic, but something just seems to have been slid here. What's your sense of that reasoning, that there's just not enough staff at this point?
Well, I think it's a reasoning that is based in reality. There just are not enough healthcare workers, medical workers that are trained to work in ICU. Mm-hmm. Because that is a specific type of training. I think we've seen the issues that we've seen manifested in Acoma, Cañoncito, and Laguna. The same issues are impacting the old Loveless Center in right. Albuquerque. They have 200 beds, but not enough staff to really, bring that dream to reality as far as additional beds in the area. So right now, there's it's a huge issue of staffing. And then also the other issue is on trust, because right now the messengers, whether it, from the state and from the federal level, we need to have, fresh faces with, fresh credentials to really start talking about the reasons why decisions were made the way that they were made in Acoma, as well as, the type of criteria that we need to be able to see for these other hospital rooms and beds to become available.
Mm-hmm. Dan, let me read you a quote Senator Tom Udall, who is also vice chairman on the Senate Indian Affairs Committee, I might add. Quote, tribes across the nation have met this crisis with resilience, but their federal partners aren't rising to the challenge. It's wrong, it's dangerous, and it's a complete dereliction of duty. IHS needs to provide clear, direct answers about where the people of Acoma, Laguna, and Tahachally are going to be able to have access to emergency and hospital care during this public health crisis. Pretty strong words there. What do you make of his reaction?
Yeah, I mean, it's, look, this is not an issue that we should be making political, any of us. I think, the sheer fact of the matter is we've touched on this, right? Mm-hmm. I mean, you're talking about, first of all, when the pandemic started, some of the biggest news nationally was how it's affecting Native Americans. Mm-hmm. I mean, some of the biggest hotspots off the charts when this first came were Native American areas. So now you're taking places that already have 2 or 3 individuals that work there, and they're saying, look, I got to get out of here. I'm not staying in, this far out. You can't leave a facility open with the idea that it's an emergency room if you don't have people trained to handle emergency cases. And so I think Senator Udall, instead of waiting until this happens, having been on the Indian Health Services Committee, I think that, we should be looking ahead of the time saying, hey, maybe we shouldn't have 3 people that can work at this facility. We should have 9, and we should have a rotation, and we should do something. Now, I think they're not thinking outside the box, the federal government, because I do think there's ways to address this, and it's utilizing our military. Mm-hmm. Now, I'm not sure how excited Native Americans would be to embrace that, but, you can't tell a civilian you're going to go work here, but you can send Army Corps doctors, you can send, naval doctors and say, listen, we're stationing you at Acoma for the next 90 days. Right. But that takes a conversation. And I think when you start seeing this kind of stuff, when you see this stuff being fought out in the media, everybody just decides to stop talking about it, which doesn't help the citizens that need the help the most. Who needs the help the most is going to someone like Senator Udall and saying, all right, let's talk about this. How do we get some funding? How do we get military folks dispatched, making sure the tribes are on board to have military folks on their sovereign tribal land and say, listen, we've got the opportunity to do this. But I think it's a legitimate concern, right? That, you're taking civilians mm-hmm. that are living in some of the hottest spots that you see on the media every day. And I think they're saying, look, I don't want to stay here. The money's not worth it. And they leave. And when they leave, there's not a lot of folks left that can man the station, which then leaves you with no option but to.
But I think that the staffing issue is more nuanced. I don't think it's an issue of, well, there just isn't enough staffing and people don't want to be out there, although that does contribute to it. But as far as I read in the reporting, I thought it was more about the negotiations of building the new facility in Laguna and the transitioning. The staff were offered options that were not good options, and so they opted out of staying on. And so it's a much more nuanced situation that I think Senator Udall and Congresswoman Holland are right to be asking these questions right now.
Mm-hmm. Well, I would also say, it's interesting that you look at how many Native American entities we have in New Mexico, and this situation is at Acoma. It's not at Mescalero. It's not with the Jicarillas right now. So everybody else seems to have kind of figured out how to make this work. And Acoma seems to be having some heartburn with this, which they should for their citizens. But it begs the question, where are all the other tribal entities that are being harmed by these actions? They don't seem to be there. So at some point, everybody's going to have to put the politics aside, sit down and figure out a way to solve this, because the only people that are hurting are the tribal members that live there that can't get the help they need.
Good stuff, Dan. Going to leave it there. Our panel has one last topic, the state legislature, when we return.